All right, we're going to
Yes,
get
go ahead.
started here. Well, good afternoon, everyone, and thank you for joining us. My name is Shannon Cunningham. I'm M&A's Director of Governmental and Community Relations. And before we begin here today, I just have a few housekeeping notes. So for those of you who are with the media, you'll also see there are a lot of other names on the screen. We have invited some of the impacted M&A members to hear about this historic moment. However, to those members, this is a press conference, so we just ask that all M&A members remain on mute for the duration of the press conference so we can ensure clear audio and minimal disruptions. Press, I ask you to please add your outlet to your name as we will only call on you if your outlet is identified. You may also put questions in the chat and we will try to make sure we answer them. At the end of President Rubish's remarks, we will be taking questions. So if you are a member of the press and would like to ask a question, please use the raise hand feature on Zoom. And then when you are called on, please introduce yourself and your outlet before asking your question. Thank you all for your cooperation, and I'm going to turn it over to M&A's President, Chris Rubish. President Rubish.
Thank you so much, and good afternoon. Today's update is not the update I had hoped to give. Despite spending another 8 hours attempting to negotiate with Essentia Health and Aspirus, nurses at Essentia and Aspirus St. Luke's and 6 other Essentia clinics have decided to file a 10-day unfair labor practice strike notice. This notice comes as our employers continue to violate labor law, including bad faith bargaining, violating our contracts, and other unfair labor practices. Our notice gives hospital executives until July 8th to stop committing ULPs, to remedy those that they have already committed in order to avoid a strike that is set to begin on July 8th. We are tired. We're tired of working short-staffed. We're tired of calling management for help and being told that there's nothing that they can do. We're tired of being told that we are skilled, valued nurses, but having our clinical judgment for assessing patient care needs ignored. We are tired of employers investing in real estate instead of additional care staff. And most of all, we are tired of being told by our employers that we are valued and then have them turn around and violate our contract, bargain in bad faith, and commit unfair labor practices against us. Nurses have decided to make this difficult decision to strike, not because we want to, but because Essentia and Aspirus continue to violate the law. Essentia and Aspirus executives have left us no choice by violating existing contract language, refusing to address key proposals, and failing to negotiate in good faith. Nurses are taking this legal action to hold our employers accountable and defend our rights under the law. Enough is enough. We must hold Essentia and Aspirus accountable for their unlawful actions. And this is why Essentia and Aspirus nurses are submitting notice today to begin a strike on July 8th and stay out as long as it takes for them to follow the law and with us in good faith. And I think with that, we can take any questions.
Thank you, President Rubish. We're now going to open the floor for questions from the press. Just as a reminder, please ensure you're using the raise hand feature if you'd like to be called on. When your name is called, you'll be unmuted. And at that time, please state your name and media outlet before asking questions. And just again, a reminder to the other participants on the call to remain on mute during this portion of the session. Let's begin. Questions. So a couple questions here in the chat for you, if you can see those, Chris.
Yes, I can. Let me open up the chat here. So first, I apologize. The internet, modern technology is always a little cumbersome. So for those who might have experienced a lag or a delay, yes, our announcement is we are intending to strike as long as it takes.
Jeremy Olson from the Star Tribune has his hand raised. Go ahead, Jeremy.
Hi, Chris. I'm wondering if you can talk through why this action is being taken in the Duluth hospitals, but not the Twin Cities hospitals, when unfavorable labor actions were alleged across all of the hospitals.
Yeah, absolutely. So first, I will say that our metro facilities, their unfair labor practice strike authorization vote still stands, and I would certainly encourage their employers to get serious about negotiating in good faith soon, because that authorization vote is still there. In terms of why the nurses in the Twin Ports are making this announcement today, I would say the nurses in the Twin Ports are the place that we're seeing an employer that's attempting to drastically cut sick leave, health insurance, bereavement leave, vacation. We have an employer that for more than a year and a half has been negotiating with our clinic nurses, unwilling to give them a simple confirmed work agreement saying what days of the week they work, and also continue to change their work schedule, which is an unfair labor practice. In the Twin Ports, we have an employer that is seeking to remove contract language that states they can't staff based on budgetary needs alone. These are incredibly aggressive, anti-union, illegal, and frankly, unsafe for patient proposals. And that's why this is where this is starting.
Chris, there's a question in the chat from Tim Burns with KSTP. Did a majority of nurses at every hospital authorize a strike? And do you have specific numbers for each facility?
Yes, thank you for the question. Minnesota Nurses Association doesn't release specific numbers, but as we said, after we conducted our unfair labor practice strike vote, an overwhelming number of nurses at all of the facilities who voted, including hospitals across the Twin Cities, across the Twin Ports, our clinics, as well as our advanced practitioners, all overwhelmingly authorized unfair labor practice strikes.
I will always appreciate Jeremy Olson for his questions. So Jeremy Olson with the Star Tribune has another question for you.
Sorry, feel free to prioritize anything in the chat. I just was using this
You're good,
feature.
Jeremy.
I guess I wondered if you could talk through, of course, in 2022, there was a 3-day time-limited strike with a specific strategy there, but now you're talking about an open-ended strike. Can you talk about the decision in doing that versus a time-limited strike?
So in 2022, as many people remember, we did conduct a 3-day unfair labor practice strike. At the end of that very long negotiations process, many facilities were able to achieve language that we felt took a big step towards improving staffing. At the facilities here in the Northland, we made a good faith attempt to create joint staffing committees with our employers where we would sit down, review staffing grids, and if needed, go through a mediation process to look at what the patient care needs would be and how we would staff to care for those patients. For my employer in particular, Essentia Health, not only are they not interested in considering our improvements to that proposal, but they want to take that away. And so I think that's another answer to your previous question. Why is this happening here? Not only is Essentia Health not interested in talking about fixing staffing, they want to take a step back from where we ended in 2022. That's the tone that we've been seeing, and that's wholly unacceptable.
Are there any other questions for President Rubish?
Heck, I'm just going to jump right back in then.
Yeah.
Uh, are talks scheduled in the 10 days? Sometimes hospitals have to shut things down and they have to start hiring replacements, and then talks don't take place after a notice. Do you have talks scheduled? Could this still be averted?
We absolutely hope so. I know as we have been meeting with our employer, Essentia Health has told us not to hold out hope that they would consider our staffing proposal, but we're healthcare workers. Hope is something that we deal with every day, and we will continue to hold out hope that we can avoid this strike. Nurses at Aspirus, as well as Essentia Twin Ports hospital nurses, have negotiations scheduled for Monday, and we look forward to that opportunity for our employers to come seriously and consider our top priorities. Our Essentia Health Clinic nurses have negotiation sessions scheduled throughout the week as well. And we equally expect our employers to come to the table and get serious. It's been a year and a half. It's time for these nurses to get the fair contracts that they need.
Other questions for President Rubish?
All right, I'm just going to keep jumping right in. Sorry. But I mean, I think it's natural to
I
ask. I
apologize.
mean, you care about your patients, and the patients are going to be left behind for the new, so and less dramatic wording, but you get what I'm meaning. And are you concerned
Mhm.
about, already bad conditions that you're describing in the hospitals? Now it's going to be without the nurses, with replacement nurses. What are your concerns there?
Absolutely. Patient safety is always at the top of mind for all healthcare workers. And I think one of the problems with that logic is that it sows a really false narrative that feels to me a little bit like an abusive relationship. We're not going to engage with you on fixing the problem. And by the way, if you try to solve it, if you try to negotiate over it, if you try to use the law and our union and an unfair labor practice strike to make conditions better for every Minnesotan, we're going to say that you're abandoning patients and risking patients. To me, that seems like a way for employers to not take responsibility, the responsibility that they have in fixing this problem.
Getting a few claps there, but I appreciate that our amazing members are remaining silent. Are there any other? Oh, we got Erica here. So Erica Zurich from NPR News has a question for you.
Hi, Chris. It's Erica. Um, I'm just curious if is bargaining going to continue during this time period before July 8th, or are you done bargaining?
We have negotiations scheduled, both the Aspirus nurses, Aspirus hospital nurses, as well as the Essentia Twin Ports acute care nurses have sessions scheduled for this coming Monday. Our Essentia Health clinic nurses have scheduled negotiation sessions throughout the week. We do intend to come to those sessions ready to work, ready to stay as late as it takes. We don't want to strike, but we're willing to if that's what it takes.
Thank you.
Of course.
Other questions? I'm holding out for Jeremy Olson to have one more from the Star Tribune.
Well, I won't disappoint.
No,
But
you
actually, it's a
won't.
very mundane question, and I'm sure you answered it already. Was timing? Is it like 7 a.m.? Just the exact time that this is going to start?
Yeah, so it'll be 7 a.m. on July 8th.
Thank you. I will step down now. Appreciate it.
Thank you.
All right. Does anyone else have from the media have questions for President Rubish? If not, we will wrap things up. As usual, if media have additional questions, they are welcome to reach out to me. I am putting my phone number in the chat. M&A members, I love you. Don't bombard me. But so I'm putting my number in the chat. If anybody has questions, feel free to reach out to me, and I can always arrange additional interviews. We will be following up shortly with a press release announcing the details of what we talked about here today.